Okay, now you're called in a hurry, and there's a couple of questions you wanted to ask. Is that correct?
About a medication.
Okay. Now, um, instantly, as soon as you called, there was more peace felt. Correct?
Yeah, of course, yeah.
It's all right. It's so what we'd like to the last time that we talked, we described that there was going to be there was an appointment with a specialist about a possibility of breast cancer, and there's
It's
a
okay. It's fine.
we
We did
told
that
you it was
already.
going to be right, and so
Like
but
you said.
but let us finish our sentence, okay?
I'm sorry.
No. That's great. Is that learning to allow each little process in the self sort of to complete itself, and this is because there's much excitement, much anxiety, much fear, and there's a new we want to say a reliable source with someone you can trust. Correct?
Absolutely.
So have at it, dearie. What do you need?
Okay. All right. I take a medication to help me function better. Okay? And
Yeah.
I'm supposed to take another one. And the one I'm taking right now is I'm holding it in my hand, in my left hand. It's like Ritalin. Do you want me to spell it, or is that not necessary?
Well, we've already sort of been discussing it a little bit, and what we're talking about is the deepening, heartfelt ability to let one thought complete itself, and then another thought, and then another thought, and that's what the medication is supposed to help with. Correct?
Okay. You're kind of grounding, yes.
It's actually one thought to complete, then the next thought is a lot of people will have there's a new thought that interrupts an old thought that's already
Right.
yeah. So yeah, we agree. Go ahead.
Okay, and then but it's not you just take it for like, take it and then you need another one after you take it. It's not cumulative. And there is one that's
Okay.
time released, but it's very expensive, and I can't afford to do the time released one. But there's
Yeah.
another medication that I also have taken in the past, which they didn't want me to take because it caused some kind of hallucinations at night, which really didn't bother me a whole lot, called Wellbutrin, SR,
Yeah.
150 mgs. Now, I was thinking of changing over to it, and the doctor wasn't real thrilled, but she said if I wanted to, I could certainly get off the other one and try this one. Now, I find that I get very, very tired from the one that has to help you with your individual thoughts. I don't take the second one at the right time, and I've been getting very tired and exhausted and waking up in a state of total panic, like I just did.
Yeah.
This has been
Yeah.
happening on and off the last few days. It's the only reason I'm calling you, Dale. I'm very, obviously I am very, very anxious, and I'm very irritated and very disturbed. Because
Correct.
everything was fine. I mean, I feel okay. My body's okay. The test was okay. I need a job, of course. And I ended the relationship with Buddy pretty much because I felt it was necessary. But obviously I'm going to suffer through some kind of great anxiety. And I wanted to know which of these two medicines, not that I want to take either one of them, right now, at this time, is for my greater good.
Yeah. Yeah, there you go. We've been sort of helping your mind to slow down while you talked, and there's we want to kind of gently point out that eventually there could be no need for much medication, and that the decision that you're asking us, we're going to give that back to you. And what, like now, while we're here all together, what do you think would be the best course of action with in terms of prescribed medications?
I obviously, no medication would be my choice.
You're not quite ready to handle that yet.
No, I know that. I have very mixed feelings, and I wouldn't have placed the call. Usually I don't have trouble with this. Something is telling me, something is changing inside of me. Either it's a good change or a bad change. I would try the Wellbutrin because I didn't have the highs and lows from it, I don't think, but it did cause hallucinations at night, and they were concerned that that could not be a good thing for somebody, and I wanted to try it again to see if they reoccurred, and if they did, I would stop it, and if they didn't, I would see if I got more energy from taking that pill.
We agree. We agree with your assessment, okay? And because there's a lot of changing going on internally and around you, and we thank you for requesting our advice, and we're saying we agree. We think it's worth a try. Now, the deepest concerns is it's only allowing the self to learn not to interrupt yourself or other people, and there's a deeper source of peace and quiet, and what we would like to do is to try to help you. So we agree with the medication difference, okay? But you see, there's really no perfect medication for the way your biochemistry reacts sometimes. One gives you more energy, but then also some possible more vivid dreaming, okay? And but we think that it's a good time to try the other one, the second one you named. And so what we would like to do here together is to see if we can help you come back into the field of peace. And if you're able to, it's happening, correct?
Something just changed here. I just put both bottles of medicine down on the table, and I just, I mean, do you know I'm beginning to talk like you?
Well, that's serious. It's like, if you mean slow and not quite as anxious, then congratulations. If you mean sort of like a dumb Dale, then we'd encourage you to stop.
No, you know exactly what I meant.
Yeah.
I believe Dale knows what I meant.
Yeah, we're joking. Is learning to sort of meander rather than running after your thoughts, and learning to be there for and wait for other people, and then to be giving to them. And this is changing, and this is emanating from you're beginning to understand the matrix of love, and you can feel it, and you're back with it now, correct?
Almost.
And yeah, and we understand. It's like, and you're in there, but not as strongly as you felt before. And there has been a lot
exactly.
Correct.
I was in a better place a few days ago, and I had actually more anxiety concerning my own personal health.
Correct.
And that's gone.
Correct.
And I don't know why I'm so anxious right now.
Well, the truth is that, may we say something? May we tell you where the source of your current fear is at?
Please.
Yes.
Yes.
It is making the right decision about the medication, and it was it's like one matrix wanted you to continue with the Ritalin, the other matrix is encouraging you to try, but you see, it's only going to be with proper meditation and learning how to hold this place of a more spaciousness. That's what's going to make the new medication work, and eventually could eliminate it totally. So we think your call was correct, and you have an amazing ability. Once the decision is made, the anxiety just, whoa, it's just gone. Where did that come from? It's like it's gone, correct?
Well, uh, uh, um, yes, and this has been prompted because one doctor wants me to stay on one, the other
Right.
doctor wants me to go to the other one.
Right.
So I had even more confirmation of confusion, and
Right.
I always felt I should be on the one that you mentioned today, so I got very confused inside.
Yeah. And that's what, eventually we're going to help you be able to understand better the kind of choice that's best for yourself. And, a little assistance for a little while never hurt anybody. And so this is, so we agree. We agree. Your thoughts was right, and a little bit of anxiety, confusion, because it's important. It's important. You have to, we understand you have to find a new job and these sorts of things, and that adds extra stress to these, life-changing events. So what we want to do one more time is we want to try to help bring you a little bit even more into the field of self-love, okay?
Okay.
You place one hand over your, let's go ahead and over your heart.
One hand over my heart?
Over your heart.
Okay.
Okay. How do you feel now?
A lot calmer than I feel like crying.
That's
And it's a really
good.
hard thing for me to do.
That's
Cry.
good. Yeah. These are the tears of self-love that are beginning to well up from the center of your heart. And the funny thing is that the calmer you allow yourself to sink in your meditation, there's probably going to be some tears that'll flow quite a bit. And it's like these are tears about the years of stress. Okay?
Yes, I know that.
Yeah, and it's like, why don't you call in 3 or 4 days, and we're going to give some additional refinements to the perfect meditation technique for yourself. And so in the meantime, try to hold that peaceful place. If you lose it, don't be concerned, it will come back. And as much as you can is just to lay one or both hands over the top of the heart and just say, quiet down, my friend, and see if that will bring you back into the matrix of self-respect and self-love, okay?
Okay.
Yeah, and that's what we want to help with. Is there anything else you want to ask?
No, thank you so much for answering my question.
You're very welcome. It's going to become sort of an interesting training for a little while, where sometimes you're going to be really scared, sometimes really high, but it's that calm, gentle love that we're wanting to help you remind yourself of. And then everything will work really good, okay?
Okay. All right.
Thank you, our
Thank you.
friend. Yeah.
Okay.
Okay, bye-bye.
Bye now.